Cancer early. Early detection is the key to saving lives, and joining us today is Serenity Banden, a breast surgery specialist at Hartford Healthcare, to tell us more. Serenity, welcome.
Hi.
Great to have you. So first, what is breast self-awareness?
Breast self-awareness is actually an expansion of what we used to call, we only encouraged breast exams. And now what we're saying is we want you to be aware of your breasts in general and even your chest wall. So we want you to know what is normal for you, what might be new or different for you, and whether you have any changes that would trigger something for you to come in. It does include a breast exam, and you can continue to still do a monthly breast exam. But it's more than that, and you want to kind of be aware of everything going on with your breasts or even your underarms.
I just interviewed a woman who had a lump under her arm and didn't even check there until they found it. Interesting. So what should women be looking for?
So you should be looking for any changes. So breasts can feel a little bit textured, but any new lumps, any skin changes like dimpling, rashes, anything on one breast versus both breasts, we always want to know about both breasts, but if something's happening on one side over another, that's a little more concerning. Any discharge that you're looking for, and again, kind of chest wall, so not just your breast, but also kind of up to the chest wall. I even tell people, you know, you can check up to the clavicle for any issues, and then under the arms. And anything that might concern you, even if when you get here we say it's fine, we'd rather know about it.
All right. And tell us, at what point should someone seek out a breast specialist like yourself?
So it could be really for anything. Of course, you can go to your primary care, your OBGYN for anything simple, but in reality, we actually end up seeing a lot of people for masses. We see people for any kind of discharge, any skin changes. There's a lot of skin things that'll happen on the breast that even dermatology refers us for. And then anyone who has family history of breast cancer should be seen. Anybody who knows that they have a gene mutation for breast cancer should also be seen by a specialist.
All right. Tell us, when should a woman get a mammogram and what can they expect?
So minimally at the age of 40 and every single year, though some women should be actually seen earlier, especially if you have family history or gene mutation and younger breast cancers in the family. And we can go through that with patients. What can you expect? So when you arrive, you would be asked to undress from the waist up. So it's helpful to wear pants or a skirt that day. They'll give you a gown, and then a technician will take you back to a private room with you and just the technician. They will compress your breasts in two directions. So I like to tell people kind of from top down this way, and they actually kind of squeeze you a little bit this way with your arm kind of pushed. And if you have a 3D mammogram, they'll actually do that twice, except during the 3D portion, the compression will happen with the arc of the machine kind of going over you. And total time in the machine for each kind of compression is only 15 to 20 seconds. The tech will take good pictures. It might take 15 minutes total. It might be uncomfortable, but it should never be painful. And you can ask the technician to change the compression if you need to. It shouldn't hurt.
All right. We are out of time, but great information. Serenity Banden, breast surgery specialist at Hartford Healthcare. Thank you for joining us.